Hi, so this video is going to be about how I've been on Dutasteride for 9 months now and Estradiol for 11 months now. But before I get into that, I would just like to mention that it's also the second time that I had laser hair removal done on my facial hair. And that was yesterday. So my skin maybe looks a little bit more rough also because I have to stop using my skincare routine basically for like an entire week before that. So no retinol, no clindamycin, no salicylic acid, and um, hyaluronic acid, and so on. And the retinol that I use is in tretinoin. That's where I get it from as a prescription. So I've been off of that for about a week, and it affects my skin not being able to do my like routine and stuff. But thankfully, it wasn't as bad this week as it was the first week, and I did take extra care this week to like minimize breakouts as much as possible. I was even more careful with my diet. I used like new blades for razor for shaving. But yeah, um, I guess I'll get into the other stuff. Um, I still kind of feel like I don't have a whole lot to say, but I would say between the dutasteride and the estradiol, I've definitely noticed more changes from the dutasteride, I believe. At least to me, my hair definitely looks better. Some days it kind of looks still like a bit rough, but I don't think that's like in the sense of like the density or whatever. Um, my hairline definitely looks fuller than it used to. It hasn't really filled back in as much as I would like it to, and like the areas right here. I will move my hair in just a moment, but um, as I've said, like basically every video for a little while now, it seems like the shedding like has decreased more and more as time has gone on, and overall, the hairs that do get shedded are ones that look a lot weaker. They're like crinkly, coarse, wiry, or whatever you want to call it. They look rough. They look very thin compared to the other hairs, and the hairs that are coming in are definitely like thicker. And just in general, like I see less space between like the hairs in my hairline. Like I don't see my scalp as much when I look up there. But I will go ahead and show my hairline again, even though I really don't like doing this. Um, it's like still kind of the same as it was, like as far like like with how far back it goes. And that is one of the things I was hoping to see improvement with more. But I am grateful for the improvement I have seen. Like just in general, I'm grateful for any improvement really. And I have been considering introducing minoxidil and derma rolling. I know I mentioned that I had gotten minoxidil and a derma roller in a recent video, but I have yet to start implementing that into my routine, partially because of things that have been going on, like with my mom getting her diagnosis, which has been very difficult and very emotional. I actually was having a hard time getting myself kind of in the right state of mind before I started recording this because of, overhearing my mom in another room. And just the other reason being that in general, I'm always kind of nervous to incorporate some new thing that can have potential side effects. Like the reason why it took me, or the reason rather why my dutasteride is only for 9 months compared to the estradiol being for 2 months, is that I was super afraid to start it because of all the things I had heard about side effects online. And for me, I don't really think I've experienced any negative side effects from it. Uh, the first like week or so that I was taking it, I kind of felt like a little brain foggy. But other than that, I haven't really noticed any problems from taking the Dutasteride. It's only been improvements for me. It's helped with my skin and it's helped with my hair, and for that I'm super grateful. Uh, Not really sure what else to say about it right now. I'm still thinking of incorporating the minoxidil. I was thinking about starting it this weekend so I could, cleanly start it at the beginning of a month like I did with Dutasteride and like I did with Estradiol. But I think I might wait until the new year, honestly. I'm still kind of really nervous about it. I plan to mostly just apply it to my hairline starting out because I just really want to fill that area in. So I don't know. May start it before then, may not. I'll certainly talk about it if I do. So aside from that, I guess I'm gonna move on to the estradiol, and I guess in regards to that, I would like to say that I haven't noticed super significant changes, at least not in my opinion. And I think that's like partially probably due to not taking a testosterone blocker like I did the first time I went on estradiol for transitioning. I was also on spironolactone, which blocks testosterone, and that kind of, I guess, enhances the feminization of the estradiol. I guess like there have been some changes. It's just not as significant as I remember it being. Maybe it's partially also because I'm misremembering or maybe expecting a little bit too much too soon. But yeah, I don't like feel like I look significantly more feminine yet. Um, but maybe that's just personal bias. Uh, I guess in regards to the estradiol as well. I know I had been mentioning that I was kind of in like a limbo with endocrinologists and stuff, and like going back and forth with the new place, being told that they didn't have my referral and so on. But I finally had that sorted out, and they got my referral, and I've been making calls back and forth with them about things. They sent me a thing in the mail, and I do have an appointment scheduled at the end of January to finally see them. So I'm looking forward to that. I do have to kind of get some information transferred over from both my previous endocrinologist and my therapist. The endocrinologist didn't respond to the message I sent over the My Care thing about how they wanted information faxed over from him, but my therapist did respond and she's totally willing to help. She just needed some information from them, so I had to contact them, and I was kind of back and forth with both of them some. So we'll see how that goes. I'm nervous about going to a new place, but I think it'll be good, and I think I'll get better help from there, I guess, which was the point of being moved over there in the first place. I'm thinking about asking to be switched from oral estradiol to injections, maybe, or even patches. I kind of don't really want to like do injections myself, but I think I could do it if I need to, and it's supposed to be the best way. So that's partly why I'm interested. I would like to continue monodosing, preferably, but if I have to do a testosterone blocker um, to get the kind of results I'd like, I'm definitely considering it, but I'm still kind of afraid of that too. Uh, Otherwise, I guess I pretty much talked about everything except for like an update on my mom, but I kind of want to wait a little bit more before I talk about that. It's still a difficult thing right now, but I'm, you know, doing my best to believe in things working out, and I think they can work out. My mom's really strong, and yeah, I guess that's where I'm at right now. I really appreciate anybody who watches these, and it would be cool if somehow it can help. But yeah, thank you very much. Please take care, and I wish you the best. Bye.